blah, 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 whatever it is. And all of a sudden, whoever's in the car with you goes, what'd you say? That's not what they're saying in the song. They're saying this. And you're like, no, 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 it's this. Anyway, you look up the lyrics, and one of you is right and one of you is wrong. And now that you know the correct lyric and you listen to the song again, your brain can hear it, meaning interpret it, because your ears are what you're hearing. But before you heard the correct lyric, it sounded like these other words, and you'd have sworn that's what it was. It's fascinating to me because that happens to me a lot, right? With song lyrics. I'm always wanting to look up lyrics. Am I interpreting it right? Anyway, so that's another example. So once I know what it's supposed to be, oh, now my brain can do it. But before that, it was hearing it a totally different way and interpreting that way very consistently. Okay. So auditory processing disorder, I have normal hearing, but my brain is distorting the interpretation of what those sounds are. Or I have trouble differentiating sounds. Individual sounds are known as phonemes. And maybe I hear the word bat as one sound. But really, there's three sounds. B, at. And if my brain hears b, at, when put together in a word, bat, as one sound, and then I say, well, what's the first sound? They'd be like, bat. That's a phonemic awareness issue, which is a sensory issue, but has nothing to do with what my ears are doing, has everything to do with what my brain is doing with the sound and how it can break it down or blend things together and so on. Taste or gustatory is complex. Your tongue has taste buds that definitely differentiate different tastes, but your smell sense enhances your tongue's ability to do that. And oftentimes what we decide tastes good or not has to do with what it looks like or feels like or smells like in our mouth, in our, smelling, looking, feeling. And that has nothing to do with what our taste buds are telling our brain. So taste is complex. It's multi-sensory in terms of what our brain decides is good or not good. But taste by itself is simply what are the taste buds along with my smell sense interpreting as taste. Okay. Olfactory or smell, besides being connected to our taste and enhancing that, people who have the inability to smell still taste food. It tastes different than someone who has the ability to smell, but they can still describe a taste that they experience. Like think about when you have a really bad cold and your nose is so stuffed up. You're eating food and you're like, yum, yum, yum. And the reality is you probably can't actually taste it in the traditional sense because your nose is so plugged up, but you're still interpreting taste. And a lot of it is sensory, as in feeling. Like greasy food feels different than a vegetable in your mouth. Crunchy chips feel different than a mashed potato or whatever, and so on. But the other thing that's important about our smell, our olfactory system, has to do with affect regulation and interpretation. Of all of our external senses, the one sense that will most robustly trigger affect memory is olfactory. It is right next to your limbic system, which is where affect memory is stored. So smells can trigger memories stronger than anything else if there's a smell associated with the memory. So sometimes trauma therapists have told me they use natural scented or natural oils to help develop a safe space that people can use as a tool to help them get out of panic mode and go back to safe, emotional and cognitive safe. And what they'll do is they'll be working on that safe space visualization and so forth, and pair it with an essential oil that isn't paired with any trauma memories. And also, to increase the benefit, also helps with a calming effect on your nervous system. Like lavender is one that is calming, physiologically calming. So if I start to pair that scent along with the other cognitive safe space work that I'm doing, it will help me get there better because of its olfactory connection. If there's a memory that's traumatic that a smell is attached to or a part of, it will elicit that trauma trigger more strongly than other things in the sensory system. So that's important from both directions. It can be a bigger negative, but can also be a bigger positive. So it can be used as a tool, but also to help people gain understanding. This is why it's so big. It's your smell sense. And that's the one that's the most closely wired to those emotional memories. Okay. Last external sense is touch. That comes through our skin. It's a foundational one in terms of when we think about just the sensory system being regulated just by itself without all the other memory and all the other things involved. Touch is a foundation to self-regulation, and what touch will calm me is very individual. Infants, many infants, in fact, we try it first because it's so common, swaddle in newborns, right? Because their sensory system is, things are flailing without their control and they get dysregulated. We contain it, they feel less dysregulated. But some babies, you do that and they're like, let me out of here. And until you unswaddle them, they will not calm down. Most babies, it's the opposite. So you have to be, trial and error. If it's working, keep doing it. If it's failing, stop and see if it has any positive effect. Maybe it has nothing to do with being swaddled or not swaddled. But anyway, some kids, they're having a tantrum and a parent will just do deep pressure touch on their limbs and they calm. Some kids fall asleep better if you do that. Some kids like the tickle back. Some kids just want you to lightly hold them or be in close proximity, or they're going to hang on to you, but you can't hang on to them. But there's some touch involved in helping me re-regulate many times when I'm a little kid. And for many adults too, like, you're upset about something and someone you are close to gives you a hug can be very comforting for many of us, and so on. There was a little bit of talk about touch in schools and can I hug a kid or not hug a kid? And all those are valid questions and complicated answers. And they're important to consider. And getting permission is really important. In fact, I've noticed when I go to the doctor, doctors are clearly getting trauma training because they will ask, I am going to do this, whatever the touch is, like I'm going to listen to your heart and I'm going to put this on your chest. Are you comfortable with that? If I had trauma about being touched in that, similar way or whatever, and I was asked that, that would be significantly meaningful to me. And if I was not okay with it, I would feel very supported when I said no. And if the doctor was now going to work through with me, what would you feel comfortable with? And they really want to listen to my heart. Well, if I'm holding it, and so on, right? If I'm going to work it out with my doctor, my level of feeling safe and in control of being at a doctor appointment has just gone up significantly. So what kind of touch, getting permission, if I'm your teacher and I don't know you and you come up and hug me, I might talk about boundaries with that child, but I'm not going to reject the child. But I'm also going to maybe check in with parents about, hey, they're kind of randomly coming up and hugging people. What's your interpretation of that? What's happening? Are you comfortable with your child being hugged, or should I not really let that? I would involve parents in that, and so on, and avoid any kind of touch that child looked or said they didn't like. If they're being unsafe and you're in a school, there is a safety protocol. Whatever that protocol is what you need to follow. That will protect you legally, and it will be what is the common language and procedure for the other staff in the school as well. So that is important. If you have some significant issues about whatever that protocol is based on things you know, I would talk to the people who would have the authority to look at and consider what you're saying and changing and adapting. So if you're in an institutional setting, there is a safety procedure when someone is doing something unsafe. Some people were talking about isolated seclusion rooms. There's a lot of controversy about those. I agree with most of the questions and concerns about seclusion. I also agree with containment to keep people safe. And how do we honor both with the least amount of trauma associated with that is the dilemma and challenge and problem solving process every time. When I worked at a hospital and we had the seclusion room, I or someone stayed outside the door, which had a window on it. So they had a person present, but had a door between them because they were being aggressive. And I would always talk about when you're ready to be safe with your body, when you're done hitting or biting or whatever they were doing, I will open the door and I will sit with you and I'll be in the doorway. So you don't get to come out of the room, but I'll open the door. And that was a process, right? So you keep a door between you. Well, if that's the only way to keep everyone physically safe, you don't need to abandon them. Sometimes they didn't want you by the door. Okay, I'll honor that, right? You can pick, kid who's in seclusion, if you want me by the door or not by the door, but I'll be within earshot so you can tell me when you're ready. Okay, so what level of engagement do they want, and how do I communicate and allow them to truly be in charge of when they're ready and to have that next stage start when they're ready to have the door open, be safe. Sometimes they didn't want the door open, even though they were done being aggressive. All right, we'll open it when you're ready. Things like that. But yeah, to put them in, leave them alone and let them work it out themselves with no support, I also agree that's traumatic and not helpful. Internal senses, vestibular. If you're an OT, you know what that word means. If you're not, you may or may not have heard of it. Vestibular is my brain being able to interpret the pull of gravity on my body, but also to understand how gravity affects objects around me. Everything goes down, right? So I can feel gravity on my butt as I'm sitting in the chair. And that feedback coming in through my butt to my brain helps me know if I'm leaning over. And if I'm leaning over, if I didn't make adjustments in my muscles, I'd fall. Okay, so vestibular gives me information about gravity and how it's affecting me and staying upright against gravity. If you've ever had vertigo, that means your vestibular system is out of whack and you're getting misinformation or no information about gravity. And you get dizzy, you get disoriented. If you have complete shutdown of the ability to interpret gravity, you have complete inability to so much as lift your head off a pillow without getting disoriented. You know, think of that feeling you get when you're on a cliff or something and you go, whoa, it's like that, only times a whole bunch. And you can't orient. So it's a baseline self-regulation skill and input, if you will, to our, in our sensory, you know, okay, we're at the bottom of the triangle. We got touch, we got vestibular, and we have one more, which is proprioceptive. That is your skin again, and location and connective tissue. So when I move my fingers, it makes my connective tissue move, right? Which gives a sensation, which helps my brain locate where my finger is in time and space as it relates to my body. So I know my hand is, I can't see it except if I cheat and look in the screen. But I know my hand is over here on the side of my head, kind of behind it a little bit. And I know I'm wiggling my fingers and they're all taking turns. Now they're doing it together. I can feel that. I know it's happening even though I can't see it. And my proprioceptive system is giving me that information through movement. But I can also just hold it here and it's not moving, but I'm still getting input from my connective joint tissue and so on, and it helps me know location. That's pretty vital when walking or doing anything with motor skills. If I don't know where the body part is I'm trying to move, how do I make sure it does what I want it to? Like when I'm walking, my feet have to be in some kind of rhythm, right? Knowing when to change places. And how do I not run into my own feet? Or, most of the time we don't trip on something. Every once in a while you do. So your visual system's a piece of information that your proprioceptive system uses a lot as well. But if I can't sense location, it's going to make motor planning really difficult. If I see a gallon of milk on the counter and visually I concur or conclude rather, the gallon of milk is full, I will then create a plan about how much motor force I need, and my proprioceptive system will help me guide my hand to the object, grab the handle, and now decide how much muscle power is needed. The gallon of milk is full. I think I need more muscle power, but it's empty. Now I've used too much motor power. So that's that integration of motor planning, proprioception. That's an example. Or the opposite. I think it's empty, but it's full. I'm going to approach picking it up with not enough motor power, and the likelihood of dropping it is high. So, boop, or, oh, dropped it, right? When I don't appropriately assess the situation, if you will. So those are things that have happened to most of us once in a while, and you get it right the second time. But most of the time you get it right the first time. If I have trouble with that skill, I'm going to get it wrong more often, which means I'm going to trust myself less. I will experience more anxiety before I go pick up anything because I might drop it and I can't figure out how to be able to predict it better, for example. Interoceptive has to do with my sensory system's feedback to my brain about what's going on in my body. Am I hungry? Am I sleepy? Do I have the flu? Do I have to go to the bathroom? We get sensations from our body to our brain, which our brain then interprets. Sometimes I interpret minor sensations, let's call it gas bubbles, as I'm gonna have diarrhea and have an accident in the store, but I just have some gas bubbles and I can't tell the difference. I'm gonna feel stressed every time I have a gas bubble. Oh my God, I gotta find the toilet. And then a little tube comes out. Oh, but how do I tell the difference? You can see how that becomes a stressor. Some people are more bothered by the itchy feeling of a mosquito bite or a rash. Oh, that's me. Oh, itching, no. Burning, better. I don't like burning, but if I had to choose, not burning my skin, but the burning sensation of like when you skin your knee, how it burns, that kind of feeling, versus an itch, I'd rather have the burn. Give me the burn. And people are like, oh, no way, I'd rather have the itch. No, I can't handle itching. Ugh, drives me crazy. I mean, I don't enjoy burn, but I can handle it better than itching. That's just me. Other people feel different. Anyway, so when I was a kid, I'd scratch mosquito bites till they were scabbed over. And sometimes I still do it, not because I did it on purpose, but because I kept scratching it without even realizing I was. See, now I'm itching because we're talking about it. Okay, so that's interoceptive. If I don't know when I'm hungry, and you're a kid who, when I'm hungry, I get really dysregulated and crabby, you see a problem there, right? Sometimes parents recognize if my kid's hungry, they're more dysregulated. So they're always trying to give them food to try to prevent it. And then the kid who's like, if you're trying to make me, I'm just going to say no. And now we have a dilemma. Well, you're right, I can't force you to eat, but I'm describing all the benefits. I don't care, I don't care. Well, the food's available if you want it. Here you go. But if you're going to be crabby and do things that get you in trouble, you're going to be in trouble. So it's your choice. I mean, that would be how I'd start. Like, I'm trying to help you, but you don't want to eat. Okay. I just recognize that you're really irritable right now, and oftentimes food helps you. But if you don't want to try food, that's fine. But if you're going to do and be irritable, you might get yourself in trouble. Not you are going to be in trouble. They may or may not be in trouble, but plus it might just be harder for you to be in the world. You let me know if you change your mind, and you don't make it about winning or losing or a power struggle. It's just, here it is if you want it. Timing and rhythm have to do with developmental stages, like when our body becomes ready for potty training or some of these other early developmental things. Language processing, or language acquisition rather, has a window of opportunity from birth until 10 to 12 years old that's wide open, which if kids are being exposed to two different languages through relationships, not through TV or like that, but through interactions in real life with people, they're going to learn both languages. Well, I mean, they're going to be able to think in both languages. They're going to be back and forth and so on. And they didn't do any formal training. If I'm junior high age and I start taking a foreign language, the chances of me becoming bilingual are very low. Not impossible, but low. Why? Window of opportunity is mostly closed by then. People who immigrate to a new country as adults who don't have the language when they move often do not gain the language while they live here for years and years and years. The children always do. That's that window of opportunity in your brain. So when we talk about timing, sometimes it matters what we're learning at different developmental windows. And if we don't learn it in that window, sometimes it means our brain has closed it and cannot do it anymore, or it's significantly harder. So that's why if a child has a hearing impairment due to otitis media, they're going to put tubes in, because your brain is wiring for language and sound when you're little. And if your ears are chronically plugged, your brain is not going to be able to wire itself appropriately. It's a bigger deal when you're a child than when you're an adult if you have chronic otitis media in terms of sound and what your brain's doing. So, and sight also, they're going to be very invested in correcting sight as a child, so your brain takes in that accurate information as it's wiring for all this new information through vision and so on. If it's happening as an adult, it's still important, but it's not going to change the trajectory of your brain's wiring as an adult like it would if you're a child. So those things can be important. And then rhythm has to do with our daily routines and things like that. So think circadian rhythm, which is our sleep cycles. And if you really want a kid to fall asleep to the best of that kid's ability, have a regular bedtime that as much as possible you don't vary. Have a regular routine up to bedtime, because that trains the circadian rhythm process of your brain to prepare itself for sleep. And changing it dysregulates all of us, but the amount of dysregulation it creates depends on everybody's individual brain. Some people adjust pretty quickly to changing time zones. Others get dysregulated for days or weeks, and it was 1 hour. So there's a vast array of how, but we're talking about self-regulation, and you got a kid who's dysregulated really easy. When you change their routine, keep it as regular as possible, and understand that when you have to change it, to expect dysregulation and develop ways to minimize the negative fallout of that without it being the kid's fault. Like with my kids, it would have been manic-like behavior. And if a kid misses their nap, then they can't even fall asleep that night because they're more tired. That's what we're talking about by dysregulated. Okay. So we are self-regulated only when we are in an optimal state of arousal. It's a prerequisite for your ability to access an adaptive response to sensory input. So, like if a kid's doing this to you, the first 5 or 10, you're like, what? And then they just keep doing it. How many before you're mad at them? I don't know, It's different for every person. Maybe it's different for every relationship of who's doing it even. But at some point you're like, no, get off, right? So I can respond adaptively until I have too much of it. It goes on too long. I feel out of control of it. These are all things that contribute to my inability to access adaptive responses and to self-regulate. Okay. We're going to do our first experience. Here's what we're going to do. First of all, the point of this task is how it affects you and what you perceive yourself to have been doing when you were a fourth or fifth grader. Okay, so you're going to be yourself, but just your younger version of yourself, being a student as in fourth or fifth grade age. But the point is, how do I remember myself at that age, and how would I have responded to this expectation in the way it's presented? Okay, that's the point. The rest is just helping us get to that awareness. So I want you to pay attention to, how do I feel, and what do I imagine I would have done had this been really happening to me in fourth or fifth grade? Okay, what do I perceive myself doing to cope in this situation? That's the important part. So we're going to use our emojis again. And we're also going to use the chat if there's words you want to share, and I'll open the chat and kind of watch the words. But it's really more, sharing as I ask questions, what your responses are. In a live seminar, people are sharing in the same room, and that's ideal, but this is how I do it in a webinar. All right, so you're a fourth or fifth grader, and you're asked to do a worksheet. And also in the chat, don't share what you think things are or not, because that will be later. Okay, so people need to struggle in their own different ways to this, and sharing what you think, not our point right now, just is it a stressor? Can I, can't I, and how would I maybe cope? So this is your worksheet. You have this picture, and you are asked to answer these questions. What is this a picture of? Tell a brief story about the picture. Where in the US might you see this? Okay, so you're your fourth or fifth grade self. You've been given the worksheet and given 5 to 10 minutes to work on it. I like the emojis. I like all the... Isn't it amazing what emojis communicate? Okay. So you're looking at this picture and you see the questions. And here's a question that I want you to respond about. Is this task something that feels doable, easy? Yeah, some of you are saying what you see. I don't want you to say that. I don't want to know what you see right now. I want to know how you feel. Okay, some people say easy. I would shut down, confused, panicking, stressed. I see double. Wow. When there's 2,000 of you, that goes really fast. But I'm seeing a lot of similar words come out. Overwhelmed. I feel danger, confused, anxious, challenged, angry, easy, hard. Okay. So some version of increased stress. Yes? Wow. This is a picture I think I know, or I feel confident I know, or I don't know at all. And that changes the stress I have and the confidence I have. Do you agree that the challenge is not how hard are the questions? The challenge is that the picture is hard to perceive meaning, perception. And in the example, it's visual perception, but the perception is what's making this hard. I can't perceive meaning in this picture. Some of you perceive meaning and you're answering the questions accordingly. What would it feel like to answer all the questions based on what your perception of the picture is, and you get every single answer wrong and you get an F? What would that be like? Like, whatever it is you see it clearly and you're confident that's what it is. You answer the question, what is this picture of? Tell you a brief story about it and where in the US might you see this? You answer everything super logically and accurately based on your perception, and you get everything wrong. How do you reconcile that in your brain? Like, how do you even fix it? Like, what are you talking about, teacher? And that is a stressor. True? Hoping you say yes. So some of you say blame teacher, unfair, hopeless. Some are mad, some are blaming, some are taking it in as their own problem, tantrum. How many would give me emojis for if you think you'd be the kid who'd feel mad and in some way blame the teacher or it's other people's fault and this is unfair? Okay, a good number. Would kind of go there perceptually. Are there people out there who would do the I'm flawed, I'm dumb, it's my fault, I need to hide this from others, or they'll know how dumb I am, or some version of that? Still getting lots of emojis. How many people would respond by having to get away from the stressor, like leave the classroom or shut down in some way or rip up the paper and throw it out or get away from the stressor versus blame and yell and rebel? And all of those things can sometimes look similar, right? Okay, so that's big reactions. When you're collectively having trouble interpreting it, let's change it. Now you're the 4th or 5th grade student and you have your worksheet and you perceive what you perceive. And as you look around your classroom, you notice your classmates confidently writing answers to the questions on this worksheet. Does that increase your stress? If the answer is yes, send me an emoji. A lot of yeses in the chat. I would feel dumb. This happened to me once and I cried. It only happened once. I'm glad it only happened once. Panic. I would not like it. I would feel overwhelmed and so on. Okay. And do you agree that this worksheet being difficult has zero connection to how intelligent you are? Zero correlation. 100% has to do with your visual ability to interpret meaning from this visual stimulus, which happens to be an optical illusion. Okay, so my ability to interpret meaning is the roadblock, which could be many different things, but the roadblock created stress, which caused me to feel all the things you described, which caused me to behave in all the ways you described. And what if I interpret all of those things you said as lack of motivation? You don't care. You're so sensitive. You won't even try. You get a little bit of challenge and then you just shut down. Are any of those accurate perceptions of what's happening to you? Or are they misinterpretations on my part that end up being harmful without my intention being to be harmful? Hopefully you agree that it's unintentional but harmful. Okay. So those of you who are brave enough to ask for help would go to the teacher and say, I don't know what this is. And the teacher says, look at it again, more carefully. Does that help or hurt? Make it better or worse? And would it affect your willingness to ask for help next time? How many of you, if that was some version of that happened when you asked for help, would keep asking for help? Would anyone keep asking for help, or would you stop? If you'd stop the emoji. Like emojis disappear if you would stop asking for help. Most of you would stop at. Some of you would keep. I would have persisted also, but I recognize that's an exception. And sometimes it gets me into trouble because I just keep asking till I get it. Anyway. How often are we critical of kids because they won't ask for help? And sometimes when we say to kids, well, what makes you not ask for help? And their answer is something like, well, they won't help me anyways. We hear that as an excuse versus whatever they're trying to say to me is not helping me, right? How often do we hear them blaming rather than taking responsibility versus what they actually mean, which is when I ask for help, whatever they say to me does not help me. And it's a little horrifying when they, like how often do we say to a kid, I've read it and I don't know what it said, or I don't know what it means, and we tell them to read it again more carefully. What if I'm the kid who, if I read it carefully 10 times, I would have no more information than I have now, and that's the only thing you're giving me for help? That's very invalidating and horrifying and frustrating, because I also hate reading if that's really what information I get from reading. And now you're asking me to do it twice, and you're not trying to help me figure it out. You're just telling me to read it again because I'm impulsive and I read it fast, which I probably did. Okay. But it significantly increases your stress if everyone around you is doing it, doesn't it? Now, every worksheet you get at school, you have a similar experience. So, how long before that learned response of worksheet equals dumb, less than hard, can't do it? How long for you before you start getting a worksheet and going, why bother? How long? It's probably different for everyone. For some kids, it's the first time. For some others, it takes several times. For others, they just persist in asking and asking and asking. They're the rare exception. But how long before you just, it's not even worth trying? Like, and what does not trying look like to you? Maybe you fill in any old answer you can think of just to look like you're doing it and hand it in. You expect to get them all wrong. And you're prepared for that. And then people are trying to help you care about what you write. And you're like, whatever, doesn't matter, doesn't matter. And you see how that quickly looks like they're not motivated. Well, I'd agree at that point, that person isn't motivated. But is that really the most important thing to be paying attention to? No. Whatever caused them to feel not motivated is what I want to pay attention to. The best way to destroy motivation is to present a task that is unachievable. That's the best way. Best way to increase motivation is to present a task that is doable, but a challenge. But if I try hard, I can get there, because then it feels like a win. Barely out of reach. And maybe getting a little support to get myself there, but just a little so I can still get there as independently as I possibly can. That's how you increase motivation. So if somebody is not motivated, that is not the point of what we want to pay attention to. What happened that zapped them of their motivation is what you want to pay attention to. They might be depressed, have nothing to do with processing difference. Motivation absence is a symptom of depression, right? So differential diagnosis is important, but lack of motivation is not what we're trying to correct. We're trying to understand the cause. That's where we want to do our intervention, is whatever the cause. If they're depressed, my intervention is that depression and trying to heal depression. If it's a learning disability and they have the inability to interpret this picture accurately, I'm working on helping them interpret the picture so they can answer the questions. Make sense? Hopefully. Okay. So it's time to turn in your worksheets now, and we're going to move on as a class. If I leave this unfinished with you in terms of what was the picture, how many of you feel frustration or stress or some negative response to moving on before you have closure? A lot of you. Someone said nope. Nope. So how many of you feel relief? Oh God, we're moving on, thank God. Oh, that's done. Like, forget about that, move on to the next thing. Some people respond that way, others feel very unfinished and frustrated and everything in between. But how often do we move on and it still doesn't make sense to somebody. And then we do the next thing and it doesn't make sense to them. And they, at one, even if they stay engaged, they're going to keep getting behind because they're not getting the content, right? But most of the time they disengage pretty quickly because it doesn't make sense. They get further behind, and the further behind you are, the harder it is to even know what you're talking about, and so on. Okay, so as much as possible, we want to recognize some people might have trouble with this, and we want to normalize not knowing. Like right now, I'm telling you it's an optical illusion, and my point of picking it was to have you struggle to know what it meant so you could understand perception and how that creates that roadblock to understanding enough to be able to answer questions. But also I might interpret it differently and get answers wrong, even though my answers were very reasonable and good based on my interpretation and everything in between. Okay, so I'm going to show you another picture. And what this picture is going to do is shift some of the things that are intentionally were left out of the first one, that if you have typical or good visual processing, meaning I can look at something on a 2D surface and interpret the 3D dimension and also recall what that is, right? There's a lot of cognitive skills involved in that. But if you have typical processing, you'll immediately know what it is. How many of you know what this is? Send an emoji if you know this is a horse and cowboy. Okay. You know what it is. Some of you might be like, that wasn't what the first thing was. Maybe you were sure it was something different, and now you're being told it's this, and now your cognitive flexibility is kicking in as a, no, I definitely saw what I saw, and you want to argue and defend, which I get. I totally understand that because you perceived something different and you want to explain it. That's a pretty typical and understandable response. And it doesn't mean you're crazy, and it doesn't mean there's something wrong with you. It means it was an optical illusion and it's open for interpretation. Even this is open to interpretation. If I have trouble visually shifting a 2D object that's kind of abstract into something that's a visual memory of an actual object, this could still confuse me. Imagine the kid coming up to you in school with this version of the picture and saying, I don't know what this is a picture of. How easy would it be to say, well, look at it more carefully? But you know, there are people in the world who that would be visually confusing to, like the first version was to you. How could that be? Well, we'll talk about it a little bit. But first I want to point out what this does different. And some of the things your brain is still filling in for you to interpret it. The first thing that has happened is the blotches that are not part of the actual figure are white instead of black. So they differentiate themselves from the actual object. So you can visually disregard them, sorting and prioritizing visually. And also, there are now lines that differentiate the object from the background. Okay. So the white space is now closed. So you can differentiate where the white space of the object is from the background, which is also white. So they're the two things it does. That if you have normal visual processing, you immediately knew this was a horse and a cowboy, unless you've never seen a picture or a real horse and cowboy before. You had no visual reference for it, if you will. Okay. So now that you know what it is, how many of you can answer the questions easily and confidently? People are talking about Halloween. Yeah, okay. You can do it confidently now. Awesome. How many of you are like, show me the first one, I want to see it again? And like the song, where once you know the actual words, you can now perceive them. Do you think you'll be able to go to the other object now and perceive it better? All right, let's go back. Ready? There it is. I don't know if my chat thing is in your way or not. How many of you can perceive now the horse and cowboy in the original picture? It's quite satisfying. If you couldn't do it at first and now you can, it's very satisfying, isn't it? In fact, if you were doing it all in the same room, it gets really loud at this point every time. Like people are like, oh my God. And then they have to talk about it because it's exciting. And they're like, can you? Anyway, it's all positive dysregulation, but dysregulation just the same. Anyway, it's satisfying to be able to do it on your own. And if I just told you it's a horse and a cowboy, answer the pictures or answer the questions, you could do that. But it would not be as satisfying as being able to figure out how others could perceive something you are having trouble perceiving. And that's the part that can be the stressor, the trigger, the chronic frustration, the thing I start to anticipate to be frustrating, and so on. Many of you are still thinking about the thing you thought it was. Here's some common things other interpretations have been shared. Some people see all of these different black blotches as islands on a map. I can appreciate that could be an interpretation. Oh, some of you saw that. Okay. I'm circling the next thing. It's this, so ignore the rest and pay attention to these. This is a lion's face. Okay, there's an eye and a nose, and this and this and this and this. All this is part of the lion's mane. Kind of looks like a lion's face, doesn't it? I think so. I can see that and see how someone could perceive that. This one blotch all by itself looks like a dog with floppy ears, sitting down with a tail sticking out, looking up. There's his nose, a floppy ear, sitting down legs, and a tail sticking out the back. Totally looks like a dog to me. Anyone else? This one is a little more abstract. Just this blotch by itself looks like a cat who is arching its back with a big fluffy tail. And pointy ears like a cat has. The cat's cheek, so it appears to be looking away. One of its big fuzzy legs arching back, and another leg that has some white on it. I can appreciate someone's perception of that. There are other things as well. Those are common ones that people talk about. But if you had trouble perceiving it at the beginning, until it has meaning, you can't use that information to answer the pictures. And it had nothing to do with motivation, had nothing to do with intelligence. It had to do with how your brain was interpreting visual information. And now that you can see it, it's hard to unsee it, isn't it? Like now you can't not see it. It's there, it's there, it's there. Or you might have a brain where that's still really hard for you. And now you're feeling like the only one who can't see it in real life. And I'm going to normalize if that's happening to you. That doesn't mean anything to be concerned about unless this is something you experience in a chronic way. You might want to have it looked at. But it also still has nothing to do with how intelligent you are. But the white space lines, ears, horse's head, another line here for the horse's neck, a leg, and a leg. So what I'm doing now is breaking it down visually and pointing out different parts to see if your brain can take a part and bring it to the whole, or take the whole, I know it's a horse and a cowboy, and bring it to the parts. Those are different ways of scaffolding and helping people interpret things. If I was sitting one-on-one with somebody who was having a lot of trouble with this, I would actually draw lines. I would cover the parts that aren't part of the object. I might show them a picture of a horse and a cowboy in a similar position and ask them to then translate it to this abstraction, because truly it's still abstract. I mean, there's no face detail, right? There's no hand detail. There's a leg, and the basic parts are there. But how many of you have ever seen a checkered horse? I haven't, and so on. So it's still abstract, and it's 2D, not 3D. And sometimes my brain has trouble interpreting 3D from 2D. It's still a visual processing issue that most brains can do pretty well, but it's going to impact my ability to interpret things that are on 2D surfaces and what they mean and so on. So it gives me an opportunity, when I understand you're having trouble with that, I can validate it and separate it from intelligence. And also you come to me with this picture, I don't know what it is, rather than saying, look at it more carefully, start with this question. What do you know so far? Tell me what you do know about this picture. Or I don't know what to do. It's an assignment. I don't know what to do. Okay, well, what do you know so far about the assignment? Like, what do you know? What has gone in your brain? Let's start with what you know, because that gives me lots of information about what you don't know. It also helps me know what you did process, and I can build from that, right? And so if I come to you and I'm like, I don't know what to do, I read the directions. Maybe I have that executive skills challenge of figuring out where to start and what the steps are, how to put them in order, break them down, put them in order. Maybe the directions are paragraph, but each sentence is a step, but I haven't perceived that because it's in a paragraph. But if you just put a number one and a number two and a number three in the sentences, maybe I can do better with what do I do first and second. And maybe I'm that kid who tries to remember all the directions all at once and then I can't remember any of them. I need some help learning how to just pay attention to step one before I go on to step two, compartmentalize, if you will, and so on. So, what is it I know so far? What have I interpreted so far? What did that mean to you? Get information about what they do know before we tell them what they have to do. I'm just reading some of the comments. All right. Helpful? Send me an emoji if you thought this was an insightful kind of exercise for you. This is an exercise that can be helpful in you helping others get stuff. Like I said earlier, if I experience even one little portion of something, it helps me understand it better, in terms of why is it important for me to try to figure out what they didn't process or how they processed, what did it mean to them, and how could it be different than me, and how could we all be right and wrong at the same time. I'm hoping this kind of helps. Like, let's say I'm the kid who decided it was a picture of a dog. And what is a picture of a dog? Tell a brief story about the picture, and I talk about the dog liking to sleep in the kid's bed at night and they cuddle. And then where in the use might you see this? I'd say dogs are pets throughout the United States, and many people love having pets. Based on my interpretation of that picture, should I get an A on my answers? I agree, for those of you sending me a thumbs up. But how often would that actually happen in real life? Because the teacher's expectation is that I'm talking about a horse and a cowboy, and I'm giving answers about a dog. And I as the teacher, I'm like, dog? What are they talking about? They didn't get the assignment. Now you get an F. But you actually did a really good job based on your interpretation. So when kids hand things in and everything's wrong or most of it's wrong, and you're like, where did this answer come from? These are really good things to check out with kids. So I'm curious about this answer. Tell me how you got it. Like, I'm asking for them to tell me their process. What information did you have that informed your answer? And if they just go, I didn't, I just guessed. Okay, tell me more. Like, what made it hard for you to have more than a guess? Like, did you have anything they started with? Or did you have zero idea, so you just guess? I'm just going to start asking questions. And if it's I had zero idea, I just had to guess, I'm going to get really curious about that. And I'm going to say, I can tell you put some time and effort, and I want to figure out what happened so we can help it go better next time, if possible. Most kids interpret that as helpful. If a kid's like, no, because they don't want to put extra effort in, like, okay, well, this will help me. I'm not going to have you write it again. I'm just trying to understand what happened so I can help you get the information better next time. I want to learn how to do it better to help you. I'm going to put it on me. Okay. Because it is on me. I want to understand better so I can help you more, because that's the truth. Not, I need you to pay attention better. I mean, that might help, but I want you to help me right now understand better what happened, what made it hard, what made it whatever it is for that kid. Okay, if you want this picture, it's not in your handout because it is a copyrighted thing. But if you Google images and just put in the search bar, horse cowboy optical illusion, this one will pop up with several other choices. The second version, I used to be able to find on Google Images. I haven't been able to recently, but you can create your own by filling in the lines and whiting out, leaving the outline of the ones that aren't part of the cowboy and horse. So you can create your own. But this one, oops, It only goes one direction, evidently, when I use my mouse. This one you will find online for sure, unless it's changed in the last few months. Okay, let's see. Let's talk about questions, Gwen. I love your comments in the chat, by the way, people.
Okay, super interesting. I did not see that either. I couldn't, I thought volcano, and I saw some other people guess that too. So I'm glad I wasn't alone.
So you got validated.
I know, exactly. I do feel validated. That is helpful.
And you got in touch with how important validation is.
Right, exactly. We all feel better when we're validated, don't we? Okay, so going back to figuring out a child's ability to know what we can expect of them. What if they are oppositional and refuse to do any work or evaluations? So, how do we kind of get a better idea of what is reasonable to expect from them without pushing them too hard and still be able to support them at the level that they need us to?
When a kid is oppositional and refusing, I just keep trying to build enough trust for them to engage. Let me know when you're ready. I really want to help you. Over explain, validate. I can tell this is really hard. Maybe I'm going to do some guessing to see if they'll respond to that. Literally, sometimes kids will give me one of these. Like they're laying down, their face is covered, and all that you can see is their hand, and they'll give me this or that as a response. Are they answering me? They are. So I have to adapt my questions to accommodate this answer. But them answering in that way is them answering. So whatever they're willing to communicate, I'm going to accept, and I'm going to continue to try to build trust and through validation and really patience about this is really hard. The older the kids are when this kind of intervention starts, the more defensive years they have built up that you're going to have to work through to build trust before they're going to take a risk. So just recognizing that, right? And validating and reinforcing anything they can give you. And also, maybe they don't have the words. That would be one of my guesses. Like, is it so a yes or a no, a thumbs up or a thumbs down, or a nod or a shake, or a yes or a no verbal? Is it, the answer, but you're having trouble putting it in words, or you don't even know how to create an answer? Is it one or two? That could be a one or a two kind of response, right? Or a yes, no, you just ask one of those two and wait for them to say yes or no. So if they know the answer but can't make words, that gives me information about what's breaking down. If they can't even figure out what the answer is, that gives me information about self-insight, other things like that. If it's, I don't even want to look, I'm going to be asking questions about, I bet it's really hard for you to get this if even looking at it is upsetting. It kind of seems like this has been something that's been frustrating you for a long time. So back to validation again, and so on. They'll answer you when they feel safe, and when you find a way for them to express it that doesn't overwhelm them and make them feel stupid. And sometimes this is all you're going to get, and that's okay. That can be something you appreciate and reinforce and validate, and adjust your questions accordingly to get that. Okay. And sometimes I'll say, I so appreciate you, giving me this. And I have another question. Is that okay? Like, I know I ask a lot of questions, and sometimes it's too many, but sometimes I'll get permission. I have another question. Is that okay? And they'll be like this. Okay. Ready? And okay. So that's the two of us kind of starting to be a team, right? Because I'm getting permission and they're giving me an answer of permission, and so on. So now we're starting to be a team to figure this out. Anyway, there's not an exact path through. It's really more about your intention and perception as you do it is going to change the way you approach it and what you communicate to them while you're doing it. that will ultimately build their trust that they can take a risk. And when you've successfully built that trust and they have a processing difference that may or may not have been identified ever, but they have one and you've built the trust, what you're going to start to get is, wait, that doesn't make any sense to me. And they won't feel dumb or embarrassed. They'll just be like, whoa, my brain, they'll also start to adopt the language. My brain didn't get that. Instead of I didn't get that. It helps take the me part. It's how my brain works. It's not what I want. It's my brain's functioning, which isn't what I'm choosing. It's just something my brain hiccups about or glitches or whatever words you use to help them describe it. And sometimes my brain does that and I'll be like, well, wait, I know I asked you the question, but my brain went bloop and I forgot to listen. So I'm normalizing even when my brain malfunctions or anyone else's, or mom or dad misinterprets you. And well, mom and dad even sometimes have trouble understanding. So I'm normalizing brain hiccups metaphorically.
Love that. So it just goes back to that relationship and building that trust, which is
And
so
slowing it
important.
down and being open to, this isn't a choice, it's brain functioning and processing.
Right. Yep. That makes so much sense. Okay. How do you go about supporting a child or adolescent when the parents or caregivers, could be educators, are ambivalent to changing their expectations of the child?
I'm working with the adults. Child's there with me being their voice, sort of. Like I'll say things like, well, I think maybe it's blah, blah, blah. And I'll look at the kid, I go, and you tell me if you disagree or if it's something different. And then they will. And most of the time they agree. And in fact, you can tell if you're on the right track because they start to sit up straighter because you're validating them as you're sort of speaking on their behalf. Like, yeah. Anyway, and I'm really trying to help them understand what they're misperceiving most of the time, because parents don't want to not help their kids. Parents have their own stuff also, and some are functioning at a better level than others in terms of mental health and so on. And so all of that is real and true. And it doesn't erase the fact parents want to help their kids. They don't want to mess them up. They love them. And sometimes they're messing it up bad, but it doesn't change that true desire, which is I want to help my kids. I want my kids to be happy, healthy kids. It doesn't change that. So, okay, what are your struggles? And we're working together on helping them help their kid. Or helping the teacher help the kid. And truly, teachers need to be validated too. Like, you can't come in and go, teacher, you got to do it this way, without first validating. You got 30 kids in your classroom, 10 of them are acting out. This is an overwhelming situation, and I'm going to help you with Johnny. And it doesn't mean you're doing everything wrong. And I get that this is super overwhelming. We got to figure this out together. If we don't start there, you're just going to make a teacher feel more alienated and frustrated.
Right.
Because that's an impossible situation for anybody.
Mm-hmm. Absolutely.
So teamwork, we're a team, we're a team, we're a team.
Mm-hmm. Yeah, the adults need that support too.
Yeah.
Okay, and we kind of got into this a little bit when you talked about thumbs up and thought down and thumbs down, but what other strategies do you use for nonverbal or minimally speaking kids or gestalt language processors in helping them figure out what's upsetting them, without us guessing or narrating for them, so that we can help actually address their problem more effectively?
Well, guessing and narrating is my primary way. And checking in. Is that fit, not fit? Can you show me if it's something that's showable? Can I point to something? If they're using communication devices like PEX cards or something, I'm going to incorporate that into our communication. Many times kids will start, like I have a whiteboard or I have one of those magnadoodles, a little mini one, and they'll start writing words on the board and showing me, not because they don't have language, but because they just don't want to talk. But I think sort of the parallel process that you have to think about is, if this was an infant that we don't expect to have language, how would I problem solve when they're dysregulated? It really does become a process of trial and error. And so that is a piece of it. And if the child's older, there's a good chance they have receptive language that is better developed than their expressive language. So I'm going to still talk, but provide ways for them to non-verbally respond, perhaps. I'm also going to pay a lot of attention to their behavioral reactions to different things, and so on. I mean, it's really hard. Each kid is different. So trying to figure out the way for them to be able to express it, it really needs to be a process you do with them together. And it is a trial and error process much of the time. So yes, without language, it's still what you do. It's just gonna look different, and there's gonna be more trial and error.
Right. Yeah, I saw a couple of people comment in the chat that nonverbal doesn't mean non-communicative. So
Right.
just like you're saying, use whatever form of communication will work for them to get there.
Right.
Okay. Okay. And I had a child who wouldn't get out of the car. So I relate to this question. Validating and waiting until the child feels ready doesn't seem to be practical for morning school avoidance. What are the other interventions and strategies for parents to use when their child resists getting out of the car or climbing onto the bus?
Oh, that's a complicated one. Something about schools creating anxiety and resistance. Do we know what that is yet? If we don't, we need to know that. Step one. So when kids come to me with that issue, that's where I start. Like, what's going on with school? Is there an undiagnosed learning difference? Is there bullying? Is there, I'm having trouble with social relationships? Is it I'm a perfectionist, and if I can't be the best at everything, then I don't want to do it at all? I mean, it could be any of those plus many other things. And until I know that, we can't come up with a way to think about and manage that part for the kid. Right. And then once we have some understanding of that, talking again about those pros and cons about, well, you know, you have to go to school. How can we make the school day less stressful? How can we give you a place to go if being in class is too much for you? These are different things we might explore. And once we have a plan in place that the kid thinks is reasonably manageable for them, now it's time to execute, go to school. And if it's, we're going to wait in the car all day, okay, we're not ready for them to just get out of the car and walk into school. We got to start with, let's go to school when school's not in session and practice walking out of the car and walking in the door. So that procedure feels familiar. Let's talk about how we feel when we walk in the door, when the school's empty. And, you know, how do I break it down into baby steps when it's not time to get up and leave and walk into class? How do I break it down, make it more familiar, less stressful? So I'm practicing, depending on the kid. Other kids, I might say to the parents, and this, it would totally depend on what's going on, but it could be also, well, they're ready to get out. They just don't feel like getting out. They're avoiding for some reason that doesn't involve a big stressor about walking in. Maybe it's just, I don't want to leave mom. Well, you're going to leave mom either way. You get to pick how you leave mom, not that you leave mom. That's happening. You can leave screaming and crying and kicking, or you can leave by saying goodbye, getting a hug and a kiss. I'll see you after school, and walking into school. Like, school's not the stressor, separation is. I might just staff person at the car, take them by the hand. Okay, we're going to go into school. It might be, we're going to, you know, if you're going to sit there all day in the car and mom can't go to work, that's a problem for mom, right? Because mom's got to go to work or whatever. So it just totally depends on the reason they're not going into school. But let me know when you're ready might be the first thing I try, because a lot of times they will get ready and go.
Mm-hmm.
And if that fails, then we got to get more information and so on.
Okay, good. And last one before we take a break. Our students can often quote the desired skills or strategies, but really struggle with applying those skills in a different environment or setting. How can we help students apply and practice the skills in real life settings? And yeah, I think a lot of us related services or outpatient providers can relate to that, where we're hearing about these issues and the kids can do them with us, but we still hear nothing's really changing in the real environment.
Because we're not problem solving. That's a blatant statement. That's partially, but not 100%, right? But if I'm solving the problems, helping kids learn how to solve the problem, how to, what is it I need and what would help me more, those skills tend to translate, as opposed to teaching procedural skills or techniques. They may or may not translate. In fact, they often don't. But if I'm learning how to have a conflict with a friend and figure out what happened, what do I need, what do you need, how do we make it work together, and that just becomes my way of thinking about when there's conflict, I'm going to have a better chance of translating those skills to other settings, if that makes sense. So if I'm doing a problem solving approach and I'm learning a problem solving cognitive process, that becomes something that I start to internalize over time, which serves me in other situations. What are my choices? What are my options? Which one will help me the most becomes an internal script eventually. Down to our last 50 minutes. Oh, crunch time. Okay, I skipped a bunch of slides, but they're in your handout, and I wanted to let you know about this slide. Thank you for your emojis. I know you're there now. So nice to know I'm not talking to myself. Anyway, so we talked about sensory processing and kind of do the experiential thing. And now I just want you to have some words and some sort of vocab information so things can perhaps have more meaning in having discussions and give you some context and, to break things apart and kind of look at them. So sensory processing disorder has three main subtypes: modulation, discrimination, motor-based. And then under modulation, you have three subtypes, and then two under motor-based. Okay. So these are all different areas of difficulty that can present when somebody has disordered sensory processing. OTs are the expert in this area. They'd be a great resource if you have access to asking an OT questions and for clarification and so on. In your handout, on the following slides after this particular slide, which in your handouts, at least in my handout that I have, is on page 11. I assume it's on your page 11 also in your handouts. I've given you a description and some examples of what they are. So you can have a little bit of information about each of those if you're interested. The modulation part is probably the most closely related to things that impact self-regulation, stress levels, that cause emotional and behavioral dysregulation. But all of them can. Like one example of a discrimination, telling the difference between. So here's an example that you've probably experienced. You're driving your car and you're sitting at a stoplight, waiting, and you notice out of the corner of your eye, the car's moving next to you, but you're not sure if it's your car moving or their car moving. And at first it feels like your car moving. So you touch the brake harder. And sometimes it is you. So it's good you did that and you stop. And sometimes you touch the brake harder and you keep moving. Moment of panic, touch the brake as hard as you possibly can. Cause oh my God, I'm going to hit the car in front of me. And then you realize it's the car next to you that's moving. Happened to anyone ever? It's very stressful. That's a discrimination hiccup. You couldn't tell which object was moving. Okay, so that's an example. All of us have had experiences of our sensory system letting us down sometimes. What's the difference between that and a disorder is how much it interferes and impacts your life in a negative way. That's the difference. We all have hiccups that happen where our sensory system glitches or misinterprets or something. Modulation and regulation are synonyms. So when we're talking about modulation, it's how do I regulate how much is coming in, how intensely I experience it, how much I need before it activates in my brain. Those are different areas. If I'm one that over responds, it means I feel overwhelmed and like it's too much at a very low threshold. If I'm under responsive, it means I need more before it even registers as something happening. And seeking means I may have this insatiable need to do something to help self-soothe, to make my brain be awake. Think of fidgeting. That's a sensory seeking activity. ADHD folks are famous for fidgeting. You know why they fidget? It has to do with alertness in your brain. It helps my brain stay awake. If I keep it, also, if I'm nervous, this helps me expel some of the anxiety response. But many times ADHD fidgeters are fidgeting because it helps them stay more alert. If you ask them to sit still, they get brain fog immediately and you've lost their brain because it's not available. Just a couple quick examples. So in your handout, you do have more explanation about what all of those are, but really the most important part to take away today is if I have sensory issues, it creates stressors because of some failure experiences or making something more difficult or more uncomfortable. And if all I keep hearing from those around me is put up with it, I'm not learning to cope, I'm being frustrated, I'm being invalidated, and all of that leads to more dysregulation. So we want to get more curious about what's going on and what would help. Like the kid who won't wear socks. Well, if I live in California where it never snows and I never wear socks, but I'll wear shoes, okay. But if you live in Minnesota or somewhere else cold and it's winter and you're wearing your Crocs outside in the snow with no socks, I'm sorry, that's a health issue. You could get frostbite pretty easy. So then we've got to figure out a way to help you not get frostbite, but not be unduly frustrated by having things on your feet. How do we make that happen? I don't know. It depends on the kid. But that's an example. Okay, so I'm skipping all this for the sake of time, but I'm going to do this next exercise with you. And by the way, my two exercises happen to be in the sensory realm. It's not because I think they're the most important. They're just things that help me help you feel it that I thought of. Okay, so this next one, again, you get to be your child version of yourself, fourth, fifth grade-ish age. And you just need to look at this picture and pay attention to how you feel. And you can put in the chat words if you want, or you can use emojis to communicate your feeling. Yikes, nope, eek, cringe, ouch, scrunched up. Some of you are describing physical sensations: shiver, cringe, blah, uncomfortable, yuck, pain, visceral, heebie-jeebies. Anyone get goosebumps? Freaks me out. Ears, ouch. Yes. Okay. You know what's really kind of interesting to pause and think about while you're feeling all that stress? The sound did not happen. You saw a picture of the sound, which made you remember the sound, which made your body react as if the sound was happening. Isn't that fascinating? And you're like, yeah, take the picture down. But yeah, oh, funny. But that speaks to maybe it's not happening, but something reminded you of it, and your body and your brain reacted as if it is happening. That's a trigger. Is it always a trauma trigger? Maybe it's a discomfort trigger. Like, I don't think I'm traumatized by nails on a chalkboard, but it certainly makes my body go, ugh. Could it be a trauma? Could be, but it could just be something uncomfortable that happens that most of us experience, and so I don't like it. But I'm not alone in it. Often makes it less of a traumatic kind of process. Not always, sometimes. But it doesn't have to be a trauma, is my point. It's a learned response based on enough interactions with somebody doing that sound that makes you remember it heartily enough that your body reacts as if it happened in real time. And it's a stressor. So now pretend just for a minute, you're still that student and this chalkboard sound happens. This is all pretend, but imagine it if it was true. This chalkboard sound is one that everyone else in the world really benefits from, and it enhances their learning when they're in school. So at the beginning of every school year, every student is supplied, like with their textbooks or whatever else we hand out in terms of supplies that the school supplies, a chalkboard, a little individual handheld, so they can scratch it at will throughout the day because their brain works better. How many of you who cringed at that picture now have a bigger cringe happening in that thought process of, oh my God, if that was happening all day, every day at school, how would I feel? Some of you are talking about how you're coping, which is good. But it would increase your stress. Yes, if all of a sudden it's not just this picture that I'm going to eventually take down and the sound isn't really happening, these are ways to reframe it, right? To maybe help dampen how negative the experience is. But now it's going to happen every day, all day at school in random ways that you can't predict by your friends and classmates. And when you say, I can't stand that sound, they look at you like you're crazy and go, what are you talking about? There's a great sound. I can think better when I do it. So what do you mean you want me to stop doing it? You don't want me to learn? And you're like, no, I just don't want to be crawling out of my own skin all day. How many of you, if that was true and you were having these cringe responses to this picture, would it interfere with your ability to pay attention? If yes, throw an emoji up. Would it interfere with learning? Would it interfere with your willingness to hang out with your peers who currently you consider your friends? Would it change those relationships in some negative way? Would it mean you have ADHD because you can't pay attention? No, maybe, but probably not if that was the only problem. But it's derailing your brain, right? You can't learn, you can't pay attention, you are in high distress, you're in a defensive mode of some type or a fight flight response of some type. And when you aren't allowed to escape, your stress is going to go up. Is that true? Okay, I would develop a psychological disorder. You said that as if that would be your choice, but you could, and it wouldn't necessarily be your goal. I can't even think when people are talking around me, so this would have me wanting to run. Okay, thanks for sharing those responses. That's helpful to everyone else to, one, understand I'm not the only one who would feel stress. Two, there are multiple ways it's going to affect different people, and everyone's going to cope in their own unique way. There's going to be similarities, but nothing that you can just say, this is what they'll do every time, them being any person, not just a specific person. Some want to escape, some shut down, some get mad. One person once shared in a live seminar, I would go in my classroom at recess, take everyone's chalkboard and throw them in the dumpster outside and back. That's a problem. That's a legal problem. You can see where a conduct disorder can start being labeled to kids that maybe it's not an appropriate label. The behavior fits, but the reason isn't understood. How many of you could see yourselves getting aggressive? Like there's a kid sitting next to you and you do what adults say. Use your words, not your fists. You say to the kid, please stop. And you explain it, how upsetting it is. It gives you the heebie-jeebies. And the kid looks at you and goes, teacher said I can. That'd be my response. Like, what? Come on. And I would hate that kid on some level. I'd think that kid was mean and whatever. I'd have all these negative perceptions of that kid. But that kid is annoyed with me because I'm the kid always going you need to accommodate me because my needs don't match everyone else's. So I'm always complaining, and maybe I'm a little bossy or, something. But I'm doing behaviors that are annoying. So that kid's annoyed with me. And now there's one more thing I'm telling that kid they have to do, which they need to learn. And they're like, no empathy, no sympathy. In fact, no, I'm going to do it now more because I'm sick of you bossing me around. Perhaps I'm just giving some context that could be possible. But if that happened to you, you're just trying to be very honest about why this is real and you need it. Can you help me out? And the kid turns and says no and doesn't more. Could anyone imagine themselves getting aggressive in some way? Maybe grabbing the chalkboard and go, bam, and smashing it on the floor in 1,000 pieces? A few of you could relate to that. Well, isn't that technically damage to property? And if all we pay attention to is you broke a chalkboard and now you're in trouble and you need to make restitution, are we helping you or making it worse? And I'm not saying you're not accountable to that. I'm saying if that's all we focus on. But I'm going to ask the kid, here's what I'm going to ask. What made it worth it? What was going on that made breaking that chalkboard and being in trouble about it worth it? Because you wouldn't have done it if it wasn't worth it in some way. What was going on that made it worth it? And it could have something to do with a conflict that has nothing to do with sound, but it could have something to do with sound. But I want to know what made it worth it. Not why did you do that? Why questions are aggressive. What made it worth it? Something made it worth it or you wouldn't have done it. I want to understand that because I know you'd rather not be in trouble if you could see any other possibility to solving your problem. Help me understand what happened that made it worth it. I might follow up with stuff like that if they find my initial question also aggressive. Okay. Do you see why that's important as a first response instead of paying attention to the chalkboard only and you know better? That's not helpful. I want to know what made it worth it. Something's going on. Okay. And whatever they give you first isn't the end. That's the first thing. Get more information until you have the aha. Oh, what made you this is a real summarized real conversation with a kid. What made it worth it to be in trouble when you threw the milk and hit the girl with the milk? I didn't mean to hit the girl. Oh, okay. Well, what made you throw the milk carton in anger? And it had to do with something another kid had done or said, and he was just angry and throwing his milk carton angrily into the garbage to express anger and didn't intend for anyone to get milk on them. Oh, makes sense. But everyone was interpreting at first he was intentionally targeting this girl, which was absolutely not what that kid's agenda was. Worth it to find out. Okay. How many of you are still upset with me because that chalkboard's still on the screen? Anyone? Yeah? Okay. Well, I will take it down. But how would you cope if this was true of you in school all day, every day? And the reason I just took it down is I want your brain back, because our perception of their sensory triggers can change how we respond and support or don't, right? We are better able, if we understand and take the time to really understand it through their perceptual experience, we'll stop hitting their panic switch. We will be more inclined to believe them and empathize and validate whatever's going on in their sensory experience that dysregulates them. We're going to allow them time to reset and find some ways to have some control over their exposure to whatever's upsetting them. And when we do that, children would begin to learn to manage their bodies and behaviors. They will be able to think through and think about what would help me cope and problem solve and so on. Okay? So imagine you're that kid again, the chalkboard's happening, the kid just did that to you and you've had it. And you go to the teacher and you say, I cannot stand that sound. And if it doesn't stop, I'm going to lose it. Or you say something that sounds like a threat. If I pay attention to the threat first and only, I'm missing the most important part, which is what caused that threat to happen. What's going on? Might be a question. But I can't stand that sound. I believe you. Do you see the power of I believe you? I believe you can't stand that sound. Maybe I can't relate. Maybe I love that sound. It is my favorite thing in the whole wide world. And I'm like, wow, you hate that sound? I love that sound. I love that sound. But I believe you that you hate it. Tell me more. I can't stand it. And then you start describing what you all were describing in the chat. Oh, I get the heebie-jeebies. I get goosebumps. I get a stomach ache. It gives me a headache. Oh my God, I can't think. It's happening all day long. And I believe you. That sounds terrible. Starting with validation. If I respond in a more typical way that we might respond to something we can't relate to, and we know everyone else needs it. think pencil and paper. The sound of pencil and paper scratching together, some people have that visceral response to. And they're like, people need to stop writing on paper. And you're in school. Well, you can't make that happen. That's what's going on with chalkboard in my pretend example. And all we focus on is, well, everyone else needs it, so you're going to have to put up with it. Is that acceptable to you who's suffering? Is that reasonable? Is that teamwork? Is that us working it out? Is that us meeting everybody's needs to the best of our ability? Or is it just taking what most people need and saying that's what's needed and so put up with it? And if someone said that to you when you're experiencing that much discomfort, it makes it worse, yes? Emojis if it's worse? Does it create an us against or a me against them feeling? Does it make anyone conclude nobody cares about what I need? Why should I care about what they need? And if that's my perception, I can justify all kinds of disruptive, negative behavior and not care. Is that a kid who doesn't have a soul, or is a psychopath or a sociopath? Or is that a kid who feels as if nobody cares about their needs? And are they correct? I would say no, people do care. They're having misperceptions, right? Which is why we have to problem solve. And it's the most important when you can relate the least, because you're going to be more vulnerable to invalidating them in ways that are completely unreasonable for them to manage on their own. The more you can't relate, the more you need information, because you're more vulnerable to creating a bigger problem through invalidation and unrealistic expectations. So the kid comes, I can't stand that sound. I start with, I believe you. I validate. For those of you who were suffering with that sound, if that happened, does it help you? If the teacher or the other adult said, I believe you, I see that it is hard for you, it would help you a lot, wouldn't it? I mean, you're used to everyone just going, deal with it, deal with it, deal with it. This person says, I believe you. They have changed nothing in terms of what's happening, but everything has changed because somebody believes you. You are not alone anymore. Someone believes you. And I don't have an answer. I believe you. And you already know this, I would say. Everyone else needs that sound. So we have a dilemma we have to figure out together. We're a team. We have to do it together. I don't know what the answer is. Don't start knowing the answer. Even if you have great ideas, don't start with your ideas. Start with the question. Because your idea is highly likely to be rejected if that's what you start with, even if it's brilliant. So don't start with your ideas. In fact, don't offer your ideas. Ask them for their ideas as part of the process first, because they might come up with a better idea than you. And even if it's the same idea, they're going to own it different if it's their idea. Empowering, right? We jump to solving a problem before we've given adequate time and validation to defining the problem, validating the problem, and making sure we truly understand the problem, because it's easy for us not to. I mean, we do get it right often. Any of you staying in the field, you're getting it right a lot when you guess. However, guessing correctly is less important than the process of uncovering it and discovering it together with the kid in a problem-solving process and conversation. So, if I understand how unmanageable this is to you, I'm going to ask what would help you more. And kids come up with ideas like, okay, I believe you that this is unbearable. So because we can't make everyone else stop, what would make it something you could stand or less awful? These kinds of questions might come up. And coming up with a plan that they feel like I can learn ever in school. I am not unduly frustrated. I can decide when I am at my end and have a place to go retreat to or be away from that stimulus. And the teamwork process of a whole classroom can become a whole part about, okay, I can leave whenever I need to. And we talk about where those places are that I feel good about also. And I get to decide when and how often I leave. But also, there's some maybe, how many of you feel like predictability about when the sound is going to happen would be less dysregulating than random, unpredictable sounds? It would, me too. Other people have said that wouldn't help me because even if I knew it was happening every 10 minutes, I could plug my ears, leave the room, whatever. I'd worry someone would do it in between by accident, and I still would be derailed in my ability to function with my attention and so on. Okay, so that wouldn't work for them. But for many people, predictability with my choices when the sound is going to happen would be helpful. So people still can have access, but I can remove myself so I don't get exposed to it all the time, and it's predictable, and I can decide if I'm going to be exposed or not and in what way. So I have some say over it. Maybe maybe the plan is every 10 minutes, but I'm the kid who needs it every 2 minutes just to make stuff up. Okay, I'm the kid who needs it every 2 minutes, and every 10 minutes isn't going to work for me. I can go in the hallway and do it away from the person who doesn't like that sound. So we're working on it together now. I need it more often. You need it never. And most people need it every 10 minutes. Okay. Sometimes the person who never wants the sound is going to be the one that leaves. And sometimes me who needs it more is going to be the one to leave. We're going to work together on it. We're going to share the process. That's teamwork. That's everybody's needs are equally important, and we're not going to discount any, even if they're the only one and we can't relate to it. That's the goal. And that's the problem solving process that a whole classroom could engage in working on together. Okay. So these are some ideas for managing the environment if it's overstimulating for kids, but ask them in bold letters what they need. Help them help you understand. Believe what they tell you, even if it doesn't make sense, get more information, but don't think they're just lying. Even if you think they're lying, get more information. Keep asking till it makes sense. So often, I think a kid is lying. Turns out they just haven't shared some important parts of the story yet. And it could be because they're defensive or they don't want to get judged or whatever, because it's usually a part that was their part. And I always thank them for sharing that part and acknowledge that that part was a hard part to share, but it really helped me understand. That's what I say about it. Not, oh, well, you finally confessed. Not that. Thank you for sharing that part, because that really helped me understand the whole context of what the fight was about with your friend or whatever. But we're going to problem solve together then, rather than trying to find somebody's whose fault it is. So these are some more things. Just repeat. What do you need right now? Tell me when you're ready. Come back when you're ready. I see you're upset. Let me know when you're ready. If that upsets them, what would help you? Talk to my mom and dad is what I usually hear in my office. But make them all stop. Stop what? What are they doing that bothers you? Right? Think of the kids in a classroom who, or at home or with friends, they're always trying to control everything. Well, some of that's about flexibility sometimes. Some of it could be about sensory stuff. Some of it is just, if I don't control everything, everything is overwhelming. Like, I just can't stand it if they do that. Oh, so you're trying to, maybe they're trying to prevent that, whatever that might be. So you want more information and you want to validate what they're telling you. Okay. Language. I could actually talk for 8 hours about language, not run out of things to say, because lots of reasons. But probably the biggest one that makes me so invested in this language part is it's invisible to people, and it is one of the most overlooked, underdiagnosed, and misunderstood disorders with big negative outcomes for people when they have it. It's invisible, truly, to most people. And so what I want to do is sensitize you with some of the complexities of language. Like, what does it take through language to understand what is being communicated? And I just remembered I wrote some notes when we were on break about some of the things people were saying, and I forgot to talk about them. But one of the things, actually, the only thing I wrote down is 80% of what we communicate is nonverbal or not literal. And that is very true. So that was a question in response to what if kids don't have language? But if you think about a kid who we describe as they're so concrete or literal, what we're saying is the 80% of language and communication that is not literal, they're misunderstanding, which means 80% of what's communicated is potentially misperceived. That is a problem, okay? 80% of what we communicate is not literal. So not always nonverbal, but nonverbal communication is different than verbal, right? But 80% of communication is abstract or not literal. So what does that mean? My reality and what you just communicated could be completely different than what you intended. And I'm reacting to something that I believe you said that you have no idea you said. Or it can go the opposite way, where I did and said something that is totally different than what I meant. And I have no idea that I've just told you a completely wrong set of information, because what I said has the meaning I intended it to, but it's not what anyone else would pick up based on normal communication patterns or typical average communication patterns, if you will. So developmental language disorder is our current terminology for what I'm talking about. It's gone by different names. Currently, I like this one, developmental language disorder. Language processing disorder is another one. Dyslexia often has a language processing component, so language processing and so on. But developmental language disorder is a brain difference that makes talking and listening, in other words, comprehending meaning from those things, difficult. Poses a risk for social and emotional behavior concerns, 5 times more prevalent than autism, with significantly less research. Affects about 2 children in every classroom, is associated with risk of dyslexia and other learning disabilities, can last a lifetime with negative outcomes. Okay, that's just from the dldandme.org website. Okay. Here's a research article. 6 to 8% of kindergartners were found to have a developmental language disorder defined as delayed or disordered language development, but intact nonverbal cognitive abilities. Developmental language delays and disorders are associated with a higher rate of problem behaviors in children compared to typically developing peers, and this difference increases with the child's age. DLD and behavior disorders. One of the theories currently is language acts as a tool or a mechanism to enhance emotional regulation through tools like self-talk, being able to label feelings, and communicate to others how you feel. That's one theory about why it's so predictive of behavior disorders. It's also a predictor of internalizing behaviors like depression, anxiety, low self-confidence, externalizing issues like disruptive behavior, hyperactiveness, becoming aggressive. Language delays are all likely underlying stressor that create behavior issues. So if you're working with anyone with behavior issues and you're not intentionally ruling in or out language problems, you're missing about 50% of the kids you're working with that have one. That's the current estimate, is about 50% of people presenting for therapy, whether it's a behavior issue or not, about 50% have a language impairment that may or probably hasn't been diagnosed. So they're talking about, to address behavior problems, it may be more effective to address and teach the effective use of language to improve social and academic functions. So in other words, work on how do I communicate in words and gestures and or gestures, what's going on and so on. Specific language impairment is another term for DLD, developmental language disorder, is associated with impaired mental and social well-being in adulthood. Compared to the general population, people with a language disorder more often still lived with their parents as adults. 40% had significant word finding difficulty or remembering instructions. and they had difficulty with expressing themselves and receiving information that would affect their well-being in a negative way. So like I'm getting a job review and the feedback I get doesn't make sense to me. I don't make changes, I lose my job, something like that. Health-related quality of life of children with speech and language difficulties. This is a review of the literature. It was published in 2012, and they reviewed literature from 1966 until 2011. And there was barely any research, and all they could come up with was the emerging evidence is that health-related quality of life can be compromised for children and adolescents with speech and language difficulties relative to their peers. And there's some consensus in the literature that social domain is the most negatively impacted. 50 years of research. That's all that came, because there wasn't any. Then I love this article because it very much validated exactly what I've been thinking and feeling, and just said exactly what I've been thinking with numbers. DLD is the most common neurodevelopmental disorder, and the most often overlooked and unidentified with severe lifetime effects. And then this author goes on to describe some of the negative outcomes. Estimated prevalence, according to this person's research, is 7.58% compared to the general population, which is 7 times more common than autism spectrum disorder, 46 times more prevalent than permanent hearing impairment, 6 times more likely to be having a reading disability and to have significant spelling problems. 4 times more likely to struggle with math, 12 times more likely to face all 3 of those academic difficulties, 6 times more likely to experience clinical levels of anxiety, 3 times more likely to have clinical depression. Girls with DLD are 3 times more likely to experience sexual abuse. Boys, 4 times more likely to engage in delinquent behavior. Adults with DLD are twice more likely to have long periods of unemployment. And it's invisible. And we're ignoring it. What? That's not who we are. We can't know what we don't know. So I'm telling you so you know. This is a big deal. It's huge, and it's unrecognized and not understood. I went through, got my doctorate degree in psychology, which taught me how to do all the tests for learning and IQ and all that. Nowhere did we talk about language processing disorders or even how to know what it is. And my son taught me more than anyone ever has about it. And everything in that article is true, based on my experience of observing my own child live with that. Huge, huge. There's a longitudinal study that Beichman and Brownlee did. This is older. So 1986 is when the first publication came out. But these are their findings. And they were calling it language impairment. Most common developmental disability among children with emotional and behavioral issues. Okay. I found more articles more recently that continue to validate that statement. Why are we not having that be a mandatory rule out in every diagnostic assessment? It is the most common reason there are emotional and behavioral issues, and we're not even including it in a diagnostic interview. I don't mean a full testing something. I mean the diagnostic interview. 50% of children with behavior issues have a measurable, documentable language impairment. Their Ottawa language study, which is that longitudinal study they published, they found that 42% of the children that they identified that had a language impairment at age 5, by the time they were 12, had developed some kind of psychiatric disorder. 42%. Language impairment is often unrecognized, and their data showed 1/3 to 1/2 of people in clinical settings have a language impairment. So I'm showing up for mental health services, any age, 1/3 to 1/2 have a language impairment. 50% of those who have a language impairment have never been diagnosed with one. And statistically speaking, that goes up significantly when you encounter people in correctional settings and inpatient mental health settings. How many people have a language impairment? Significant increase in those settings. And then this is a book, Language Disorders in Children and Adolescents. When that book was published, the social pragmatic communication disorder was a brand new label that the DSM-5 started using, which was they have all these impairments in the social and language realm, but don't have autism kind of a thing. So that's what that in a nutshell is. But what their point of their book is if you are in a mental health setting, working with people with mental health issues, you need to have learning or language impairment rather on your radar. Because if you don't, you are overestimating someone's language competence and you are misattributing the difficulties due to the language impairment as a behavioral issue rather than a language impairment. You are doing that unless you're recognizing the language impairment. The more severe a language impairment is, the more significant you expect psychosocial issues to be going on for adults. They are huge. I mean, think about language. When are you never using language? Never. So 80 to 85% of children identified as having a learning disability and are getting special ed services have their primary problems with reading and or language processing. This is older information again, but newer research that I'm finding, there's starting to be research, which really excites me, but there's still very little. In some states, this is by Reed Lyon, who is also this person. This is from a film, Misunderstood Minds, which came out in the, well, the broadcast was 2002. So anyway, he says this in that film. In some states, we predict prison population size based on 3rd and 4th grade reading scores. Because it's accurate. It helps us reasonably predict who's showing up in prison in 10 more years. If we don't think there's a connection between processing differences and those who end up in prison, why are we using that as a reason to predict prison population size? And then this is kind of an observation on my part, this last one. Prison inmates almost always fall into one or more of the following categories, which is mental illness, traumatic brain injury, and or a learning disability. With almost zero exceptions, they fall into one or more of those categories. And when you just hear that and not the horrific things that got them into prison, that is the wrong reasons for people to be in prison. But it absolutely supports this idea of chronic stressors create behavioral problems that when you're an adult land you in prison. Okay, higher level language skills. What are those? Those are the things that are abstract, hidden language. Higher level language skills, they talk about in this article as executive functioning skills because it requires that flexible thinking, problem solving, thinking about how does context change it, the meaning. Could be the same words, but a different context or different tone of voice or even word order can change the meaning. And that requires that executive functioning skill. And it's these higher level language skills are hard to diagnose and are often undetected with basic language tests because they have basic language. And many people who have difficulties in this area are good at faking it. So good at it that you don't even know they're faking it. So this article just talks about some different, like, can I tell a narrative? Can I tell a story with a beginning, middle, and end that is coherent and followable by somebody who's listening? Can I follow step by, do you see the overlap with executive functioning, step-by-step instructions? Can I tell a story about what I did and know the process about what I did in order and then recount it in that way? Can I understand how this something causes this outcome? So why did something happen? So the example they give in the article is I might have trouble understanding that knocking a glass vase off the table might mean I need a new vase. Because there's an implication in there, if I knocked it off the table, it would break, which is why I need a new vase. Another implication could be that I'd have to clean up water if it had water in it when it fell. But can I make that connection based on that information? And that is also a type of an inference or predicting. Use of clues or written or verbal infer further information and make a prediction. Like if someone tells me to turn on my headlights when I'm driving a car, first of all, I know it's about driving a car because headlights and car, it's not said. So that's me inferring car. Allows you to predict that the person is driving a car and that it is starting to get dark, or also could be that it's raining. But usually if I'm turning my headlights on because of rain, it's because it's dark with all the dark clouds. Figurative language is not literal. It includes idioms, which are figures of speech, metaphors, similes, what makes a joke funny. High school level reading comprehension becomes difficult because it is just hugely part of idioms, metaphors, similes, thinking about how is this value related to that, what's inferred in that, what does this mean metaphorically in this book, and so on. And all of that becomes much more complex as I get older, which has bigger and bigger negative social issues because I can't keep up in the conversation with my peers. I might try to tell a joke, but it doesn't come out in a way that fits with anything that anyone else can relate to, and so on. And I start to maybe withdraw and or kind of get left behind. So this is a list of examples of higher order language. And these are ways to kind of tease it out too. Like, does a kid understand jokes that are age appropriate? Can you use figures of speech and can they understand what they mean? Same with similes and metaphors. Multiple meaning words. There are very few exceptions to any word you use. They almost all have a multiple meaning. Sometimes, like table. Well, when I just say it with no context, you default to generic table, which is something that's flat on the top and has 4 legs, not the kind on your body, but table legs, which are made out of wood usually, but not necessarily. It could be metal, blah, blah, blah. But the generic idea of a flat surface with 4 legs, and that's all. You don't define it further. Is it metal? Is it wood? Is it? If I have autism, Temple Grandin talks about this, I might not be able to just have a generic idea of a table. My brain can't do that. I need detail. I need to know which table you mean, or I can't even reconcile what you're talking about. So multiple meaning words, but table with no context. But I can table a discussion. Now it's a verb. I can have a water table. Now it's an adjective. Well, you get what I mean. Tabling a discussion, water table, table of contents, on and on and on. There's many definitions of table. How do I know which one you mean when you say table? Well, if I say I was sitting at the table, if I say, well, we need to table this discussion, but if I can't use context to help me know which meaning you mean, how much am I not understanding in a conversation? Potentially every word. Inferential connections. Something's not literally said, it's inferred. Oh, they're a smart one. That's sarcasm. I mean the opposite of what I said. That is so confusing to people who can't do language well. Okay, what is my implied intent? Using context to gain understanding, making association, and sarcasm. Okay, Amelia Bedelia. How many of you know who she is? When I was little, I had one of her books. I still have the book, by the way. And it's Amelia Bedelia and the Surprise Party. And I could not figure out why Mrs. Rogers kept her as a maid because she made so many mistakes. And I found it so annoying. And I didn't understand why everybody loved Amelia Bedelia because she screwed everything up. Now I love her because you know what? She has a language disorder. She has a developmental language disorder in abstract language. So here's the page I found. I actually found this page online and then I went and found the book. But Amelia Bedelia and her mother drove to Rose's house. This is Amelia as a child, and these are the more modern or more recent books. Is a slumber party fun? Asked Amelia Bedelia, because sleeping is boring. Well, you might not sleep much, said her mother. You will play, eat pizza, paint nails. Look at the thought bubble. Do we paint the nails and then hammer them? Or do we hammer them first? Asked Amelia. And all her mother said was, well, you'll have fun, sweetie. I promise. Okay? The rest of the book does not go the way I'm about to describe. It is how it goes for children who have developmental language disorder. Okay? So we see the thought bubble. This is what Amelia is thinking is going to happen because that is what her mother said. You will paint nails. Multiple meaning words. She goes to the party thinking they're going to do arts and crafts with nails and paint and wood and hammers. And they, in fact, have pizza, like her mom said. And she did have fun, like her mom said. And they did not sleep much, like her mom said. But she's confused because they did not paint nails. But they're, got their jammies on, they've had their pizza, and they're all admiring their fingernails. And Amelia came up with the best idea that everyone copied, which was a great compliment. So she's pretty proud of herself. But they did their fingernail polish, and then she put dots. So she picked purple as a base and red as the dots. And all of her friends are like, oh my God, I love those dots. And they all did dots too. And so they're all admiring their dots on their fingernails with their fingernail polish. And Amelia says, as they're admiring their fingernail polish, hey, you guys, when are we going to paint nails? And her friends do one up. And then they all start laughing, like, oh my God, you're so funny, Amelia. You're always making jokes. What's so funny? We already paint. And Amelia's like, no, really, when are we going to paint nails? You're such a card. And she's thinking, I'm not a card. But she's like, whatever. And then she realizes they all know something she doesn't know because she has good social insight. And she realizes if she keeps trying to get clarification on this painting nails thing, she might look dumb. So she decides she'll laugh along with everybody else, but she has no idea what they mean. And she kind of feels like they're lying to her, but because they all kind of laugh together, something's going on she doesn't get. So they finish the party and she's fine. They sleep over, they have breakfast. Mom picks her up in the morning. And they're in the car. Mom says, what'd you do? Blah, blah. Oh, Mom, look at my fingernails. Everyone liked them. And she's bragging about her fingernails and eating pizza and some of the games they played. And then she goes, yeah, but Mom, they did not paint nails like you said we were gonna. And I was really looking forward to that. And her mom looks at her and goes, honey, you just told me you painted nails. And Amelia's now mad. She's pissed because she knows she did not tell her mom they painted nails. And her mom's telling her she did paint nails. And now she's yelling at her mom. Did not say that. I would know if I said that. Blah, blah, blah. Why do you lie to me? And her mom's like, but you did tell me that. No, now they're in a big fight. Did she or didn't she tell her that? That's how it really goes for kids with language impairments. Is that stressful? Do they ever react in ways that make you think they're a little crazy? And they are sure you lied to them or set them up or something. And you're like, no, I didn't. Well, yeah, you did. You just don't know you did. So when kids do that, rather than go, yeah, you did. You told me. Just go, what is it that paint nails means to you? If they have a reaction about something that you think means this, and they're like about it, well, and use the same words. What does that mean to you? And they can tell you, almost always you're going to owe them apologies. Almost always. They're calling you a liar, you didn't lie, whatever it might be. Find out how they came to believe that information. What were the words? What do you, like in this case, what does paint nails mean to you? And she describes it. And then you can say, oh, I can see why you are frustrated. Because can't you? And can't you apologize for being confusing? Because you didn't think you were being confusing, but you were. Because paint nails literally means what she's imagining. Because what you meant was put fingernail polish on your fingernails. But we say paint nails as a way to say that in a shorter way, but it's not literal. And how often do we say things not literal? Once you get your schedule under your belt, we'll start meeting once a week. Really happened to a kid from a speech language pathologist as they transitioned to junior high. And it was fine because I said, do you know what they mean? And the kid had no idea. The speech person described it. But imagine if I don't want to go to speech. I'm now embarrassed socially about going to speech. So you told me when I put my schedule under my belt, we'll start meeting. So I don't put my schedule under my belt. And it causes all kinds of trouble because I don't know my schedule yet. And then you come to get me, even though I've been sure not to put my schedule under my belt. Do I feel like you set me up? Uh-huh. Am I going to say some version of, you told me we don't have to meet? And the person's going to be like, I never said that, with great confidence. What did I say that made you believe that? Is a really good question. When they accuse you of lying about something, what were my words that made you believe that? But not, so you don't want paraphrasing if possible. You want the actual words, or you might not be able to figure out what the misunderstanding was. Is that making sense? I hope. I really hope. What I included for all of you today is a checklist. I got it. There's this really great tool. Write this down because it's nowhere in your notes. It's called Open Evidence. If you have an NPI number, so you're a clinician who bills insurance, you need an NPI number. You can create access to this service. It is awesome. It's medical research AI, but it's only medical research, and AI goes in and finds all the research to your query and gives you a summary. It is amazing, and it's free for now. I don't know if it'll remain free, but it's free for now. So I asked the query, what can mental health clinicians, what checklist would be helpful to rule out developmental language disorder? And it gave me a whole thing with the bibliography. So I've given that to you in a handout. It's mostly just what it said to me. With the research articles as a bibliography attached to it. And so that's a supplemental handout that Gwen was going to put on the website. So you can download that. But this is something you should include in your diagnostic interviews. Developmental language history. What were the first words and phrases? Were they delayed with onset? And it gives you first words after 18 months is delayed. Word combinations, which is after 24 months, like mommy up. Word combinations. Okay. Is there a family history? Was their vocabulary at 24 months fewer than 50 words? And these are very specific. Kids who are 10, 11, 12, parents probably aren't going to remember. But if they're younger, they might do a better job of remembering with some accuracy at least. Has the child had any speech and language prior? Were there developmental milestones in other domains met on time or delayed? Okay. And then expressive language red flags. It gives you some ideas of what to ask about. Receptive language, which is often underestimated. They have better receptive language and they're able to express often. Functional impact, like what are the academic difficulties, social difficulties, secondary to communication and frustration. Differential diagnosis considerations and screening tools. If you are someone who's inclined to use screening tools, or you're doing a psych eval, you could include some of these screening tools that could be helpful. And then gives you some action steps. If things look like they're there, okay, what do I do next? What I do next is my office mate is a neuropsychologist and she will do a neuropsych assessment, but I talk about language impairments. So she includes that. You need to find people who understand what it is and how to test for it. If you're just going to refer them to psych assessment and hope they know, they probably don't. So you need to do a little bit of research. A speech and language pathologist who focuses as part of what they know and practice language impairments, DLD, great. If they don't, if they mostly do speech work and motor skills and all that, they're probably not your person. So you want to also kind of shop for people who have that as part of their expertise because it is invisible, it is misunderstood, and most of us don't have training in it. So I'm always looking at how kids interpret my words. Do they misinterpret a lot? I'm always checking to see what they understand. If I'm using figures of speech, I'll pause and say, do you know what that one means? Do you know what that means when I say this? And if they look at me like I'm from Mars, which is me using a simile, then I know they're having trouble and I'll explain it. And I'll say, if I say things that are confusing, you just tell me, because there's a lot of confusing things and I'm okay explaining them. And if you don't understand, doesn't mean you're dumb. I always include that part and encourage the questions, because if they're willing to ask when they don't understand, I get a lot of data about what they didn't process. And that's really helpful. But 50% of your kids with behavior problems have a language impairment. That's the statistic. And if 50% don't have that diagnosis, it needs to be explored. So I've given you that handout as a tool to help you with some structure about how to do that, but really paying attention to how often do they misperceive? Are they saying you lied, or are they not following directions? Well, what did you understand the direction was? Right? And just because they can't understand multiple directions at once, multi-step directions, we default to, oh, executive functioning. Default to either that or language or both. Start ruling it out, start including it, start thinking about it. Read Amelia Bedelia. You'll get a better idea of what we mean by language impairment. And what's wrong about Amelia is it always ends happy. And I get why, but that doesn't help you understand the impact, the negative impact. What I described about Amelia and the slumber party is how life goes for kids with language impairments. It doesn't end happy like the book actually does. I'm sorry it's late. I appreciate you all coming. There were so many of you. Thank you for coming. I hope today was helpful. I know you'll have the recording available for a few days starting tomorrow, I believe. And you also have my contact information. If it's a burning question that materials don't give you, please reach out. And
thank you, Laura. That was fantastic. So many nice emojis and nice comments coming through in chat. And it's so hard to stay here for 6 solid hours and speak, and you did a phenomenal job. So thank you so much. Lots of great nuggets we can all take back and start using right away.